Canal anglais? 1, 2, canal anglais, c'est bon, test 1, 2, 3, 4, 5, test pour la plateforme, on fait le français. Test 1, 2, test, c'est OK.
Voilà. Ouais, Joao. Un, deux, un, deux. Un, deux.
Check, check. Check. Your Excellencies, honorable delegates, may I invite you to join your seats, please. The session is about to start. Vos Excellences, honorables délégués, Mesdames et Messieurs, est-ce que je peux vous inviter à rejoindre vos sièges, s'il vous plaît? La session est sur le point de commencer. Merci. Hello, sir. Your Excellency. Check. Your Excellencies, honorable delegates, ladies and gentlemen, may I ask you to join your seats, please. Vos Excellences, honorables délégués, Mesdames et Messieurs, est-ce que je peux vous demander de rejoindre vos sièges, s'il vous plaît? La session est sur le point de commencer. Merci.
Delegates, I request everyone to be seated so we can start. Ladies and gentlemen, the Assembly is now called to order. Your Excellencies, Honorable Ministers, Ambassadors, Delegates, Director General, in my capacity as the President of the 78th World Health Assembly, I have the honor to open the 79th World Health Assembly. We shall now move to Agenda Item 1.1, Appointment of the Committee on Credentials. The Assembly is required to appoint a Committee on Credentials in accordance with Rule 24 of the Rules of Procedure of the Assembly. In conformity with this rule, I propose your approval of the following 12 member states: Armenia, Bulgaria, Eswatini, Iceland, Mongolia, Oman, St. Kitts and Nevis, Sao Tome and Principe, Senegal, Sri Lanka, Uruguay, Vietnam. Is this proposal acceptable? As I see no comments, I declare the Committee on Credentials, as proposed by me, appointed by the Assembly. Subject to the decision of the General Committee, the Committee on Credentials will hold its meeting on Tuesday, tomorrow, 19 May, at 1400 hours in Room 12. Let us now turn to the election of the President. In accordance with Rule 25 and of the Rules of Procedure, at each regular session, the Health Assembly shall elect a president and 5 vice presidents who shall hold office until their successors are elected. You have before you a white paper which contains names of delegates proposed for consideration, following consultations with their respective regions as well as their respective countries. To consider the nomination for the office of the President of the 79th World Health Assembly, I recall that in accordance with the practice of regional rotation, which the Assembly has followed for many years, the President of the 79th World Health Assembly should be chosen among the delegates of members of the region of the Americas. I understand that Dr. Victor Elias Atala Laham, Minister of Public Health, Dominican Republic, is proposed for the office of the President of the 79th World Health Assembly. Is this proposal acceptable? In the absence of any objections, and as it appears that there is no other proposals, I suggest, in accordance with Rule 80 of the Rules of Procedure, that the Assembly approves the nomination and elects its President by acclamation. Dr. Victor Elias Atala Laham, Minister of Public Health, Dominican Republic, is hereby elected President of the 79th World Health Assembly, and I invite him to take this seat on the rostrum. Congratulations to Dr. Atala Laham. I wish you a successful presidency of the 79th World Health Assembly. You can be assured of my support throughout the week. That's her. He's coming on the left.
Excellencias, Honorables Ministros,
Your Excellencies, Honourable Ministers, distinguished delegates, Director General, I'd like to thank the Assembly for their trust in electing me as President of the 79th World Health Assembly. And I'd like to express my appreciation to my predecessor, His Excellency Dr. Teodoro Herbosa, Secretary of Health of the Republic of the Philippines, for his contribution to the last World Health Assembly and for opening today's proceedings. We shall now turn to the nomination for the offices of Vice Presidents of the Health Assembly. I should like to recall that since a member of the region of the Americas has filled the post of President, it would be equitable to choose the Vice Presidents from delegates coming from the other 5 WHO regions. And in this regard, the following proposals have been received. Dr. Assa Badialo Touré from Mali, Dr. Mohamed Ali Al-Gouj from Libya, Mrs. Katarzyna Drajek-Laskowska of Poland, Honorable Nisha Mehta of Nepal, and Honorable Elias Kapovore from Papua New Guinea. Are these proposals acceptable to the Assembly? In the absence of any objections, I take it that it is the wish of the Health Assembly to elect by acclamation the 5 delegates mentioned for the posts of Vice President of the 79th World Health Assembly. And I congratulate the Vice Presidents upon their election.
Ahora determinaré por
I shall now determine by lot the order in which the Vice Presidents should be requested to serve, should the Presidents be unable to act in between sessions. The names of the Vice Presidents, the 5 Vice Presidents, have been written down on 5 separate paper slips, which I'm going to draw by lot. The first Vice President is Dr. Mohamed Ali Halouj from Libya. Second Vice President, Dr. Assa Badialo Touré of Mali. Third Vice President, Mrs. Katarzyna Drazek-Laskowska of Poland. The fourth Vice President shall be Mrs. Nisha Mehta of Nepal. And the fifth Vice President is Honourable Elias Kapovori of Papua New Guinea. Thank you very much indeed. There will be seating arranged for the Vice Presidents in the first row in front of the podium, and I suggest that the Vice Presidents take their seats at the next plenary session. We shall now turn to the election of the chairs of the main committees. For the office of Chair of Committee A, Dr. Timur Sultangaziev, First Deputy Minister of Health of the Republic of Kazakhstan, has been proposed. Is his proposal acceptable? In the absence of any objections, I take it that it is the wish of the Health Assembly to elect Dr. Timur Sultangaziev of Kazakhstan as Chair of Committee A. And for the Chair of Committee B, Dr. Kwabena Minta Akando, Minister of Health of Ghana, has been proposed. Is this proposal acceptable? In the absence of any objections, I take it that it is the wish of the Health Assembly to elect Dr. Kwabena Minta Akando, Minister of Health of Ghana, as Chair of Committee B. We shall now proceed to the composition of the General Committee in accordance with Rule 30 of the Rules of Procedure. The General Committee consists of the President, the 5 Vice Presidents, the chairs of Committees A and B, and 17 delegates to be elected by the Assembly. In order to have equitable geographical distribution within the General Committee, I propose that the Assembly elects the remaining members of the General Committee as follows: 4 member states from the African region, 4 member states from the region of the Americas, 2 member states from the Eastern Mediterranean region, 4 member states from the European region, 1 for the Southeast Asia region, and 2 member states from the Western Pacific region. You have before you a white paper containing proposals for the nomination of the 17 other members of the General Committee. I shall repeat these proposals in English alphabetical order.
Canada, China, Cuba, Chipre, Ecuador, Fiji, Francia, Kenya, Líbano, Marruecos, Sierra Leona, Sudáfrica, Tayikistán, República Unida de Tanzania, Trinidad y Tobago y Reino Unido. ¿Está de acuerdo la Asamblea con estas 17 propuestas? No veo objeciones, por tanto entiendo que la Asamblea desea elegir a estos Estados miembros para formar parte de la mesa de la Asamblea. Así queda decidido. Y ¿qué vamos ahora aquí? Antes de suspender la sesión plenaria y pasar al segmento de alto nivel, quisiera abordar algunas cuestiones de organización. La mesa de la Asamblea celebrará su primera sesión hoy una vez haya concluido el segmento de alto nivel. Los miembros de la mesa se dirigirán a la sala 12. Quisiera recordarles que de acuerdo con los artículos 30 y 31 del reglamento interior, la asistencia a las sesiones de la mesa está limitada a sus miembros y a un solo miembro de cada una de las delegaciones acreditadas ante la Asamblea de la Salud que no estén representadas en la mesa. También quisiera recordarles que la próxima sección plenaria se reunirá a reserva de la decisión que se adopte en la mesa para tratar el siguiente programa. Alocución presidencial. Punto 1.4. Adopción del orden del día y distribución de su contenido entre las comisiones principales. Punto 2. Informe del Consejo Ejecutivo sobre sus 157 y 158ª reuniones. Punto 3. Alocución del director general, Dr. Tedros Ghebreyesus, director general, y debate general. Punto 4. Oradores invitados. De conformidad con el artículo 49 de nuestro reglamento interior, quisiera recordar a las delegaciones que deseen proponer una resolución o decisión que remitan un proyecto a la Secretaría hoy a las 18 horas a más tardar. Tenemos un orden del día muy denso de aquí al sábado. Para garantizar una gestión eficiente de la plenaria y ofrecer a todas las delegaciones una oportunidad justa para intervenir, confío en su cooperación a la hora de respetar el tiempo asignado de 3 minutos para las declaraciones regionales o de grupo y de 2 minutos para las declaraciones de país. Concederé 15 segundos de cortesía, tras los cuales tendré que interrumpir al orador. También quisiera aprovechar esta oportunidad para recordar a todos los delegados que el Código de Conducta en eventos de la OMS se aplica a todas las sesiones, así como las reuniones y eventos celebrados al margen de la Asamblea Mundial de la Salud. Por último, antes de levantar la sesión para dar paso al segmento de alto nivel, quisiera abordar brevemente una cuestión del procedimiento relacionada con la votación electrónica. Como sabrán, los Estados miembros ya se dispone un sistema de votación electrónica en la sala de asambleas, donde se celebran tanto las sesiones plenarias como las de la Comisión B, así como en el auditorio de la sede de la OMS, donde se reúne la Comisión A. También se dispone de un sistema de votación electrónica en la sala 12, donde se reúne la mesa. De conformidad con el artículo 73 del Reglamento Interior de la Asamblea Mundial de la Salud, cuando se disponga de un sistema de votación electrónica adecuada, la Asamblea de la Salud podrá decidir que cualquier votación a mano alzada o registrada se realice por la vía electrónica. Con el fin de facilitar el desarrollo fluido y eficiente de esta reunión, me gustaría proponer que, en caso de que se requiera una votación a mano alzada o una votación registrada durante esta reunión de la Asamblea de la Salud, y a menos que la Asamblea decida otra cosa durante el examen de la cuestión que se someta a votación, dicha votación se realice por medios electrónicos utilizando el sistema disponible en esta sala. En otras palabras, el procedimiento por defecto sería que cualquier votación a mano alzada o votación registrada se llevara a cabo por vía electrónica, salvo que se decida otra cosa en relación con la cuestión específica que se someta a votación. Como recordarán, procedimos de esta manera en la Asamblea del año pasado. Es importante señalar que, al igual que ocurrió el año pasado, cuando se realiza una votación a mano alzada a través del sistema electrónico, este no reproduce exactamente todos los elementos que se darían si la votación se llevara a cabo físicamente levantando las placas identificativas. En particular, aunque quienes los rodean pueden ver cómo vota a través de las luces del panel situado delante de ustedes, en la práctica esto no será visible en toda la sala como lo sería si levantara su placa identificativa. La imagen en la pantalla indicará únicamente qué países han votado y no mostrará el sentido de su voto. Esto contrasta con una votación registrada en la que la imagen en la pantalla mostrará en tiempo real cómo ha votado cada Estado miembro, además de registrar al final cómo se ha emitido cada voto. También me gustaría aclarar que este enfoque se aplicaría únicamente a la reunión actual de la Asamblea de la Salud y se entendería, sin perjuicio de cualquier otra decisión que la Asamblea pueda adoptar en sus futuras reuniones. También me gustaría aclarar que no utilizaremos el sistema electrónico en caso de que se requiera una votación secreta. ¿Hay algún comentario u objeción a esta propuesta? No veo ningún comentario, así que queda decidido también. Ahora suspenderemos el programa oficial de la sesión plenaria para asistir al segmento de alto nivel que incluirá los mensajes de los jefes de las delegaciones y la entrega de los premios a los líderes en la salud mundial. Se levanta la sesión.
Was a year of major achievements and challenges for global health and for WHO. The most significant achievement was the adoption of the WHO Pandemic Agreement, a powerful example of what multilateralism can deliver when countries choose cooperation over division. In addition, this year WHO validated 13 countries for the elimination of diseases. We provided guidance on innovations, including lenacapavir for HIV prevention and GLP-1 therapies for obesity. And we responded to 48 emergencies in 79 countries and territories, including Gaza, Sudan, and Ukraine. 2025 brought other serious challenges. Aid cuts threaten to reverse decades of progress, with early estimates suggesting childhood mortality could rise for the first time this century. And cuts to WHO's budget left us with no choice but to reduce the size of our workforce. But in the crisis lies an opportunity for countries to transition away from aid dependency towards self-reliance, and the opportunity for WHO to become more independent and future-proof. The world still needs WHO, and WHO remains committed to our founding vision, the highest attainable standard of health, not as a privilege for some, but a right for all. I found our world to be so beautiful. We come together as nations of the world because we choose not to be overwhelmed. We choose hope. We choose a better future.
Right now, across the world,
Lives are being saved.
quietly.
Often unnoticed.
A disease stopped before it starts. Answers found.
Fears dispelled.
Health restored.
New treatments, emerging gene therapies, more personalized care. The science is there and evolving. What's possible today was unimaginable just a few years ago.
Every diagnosis that gives a family an answer. Every test that catches a disease before it's too late. In every home, in every clinic, in every country. That is science at work.
Science shows what is possible, from vaccine-preventable diseases to mental health. It backs every decision that shapes people's health and well-being. When we use science, when we act on it together, people live, people thrive.
Science only protects us when we use it. And right now, it's difficult to tell the difference between science-based advice and misinformation. The stakes for our health have never been higher. Science protects us.
Science gives us a future.
Science heals us.
Science guides us.
"2025 was the year of major achievements and challenges for global health and for WHO. The most significant achievement was the adoption of the WHO Pandemic Agreement, a powerful example of what multilateralism can deliver when countries choose cooperation over division. In addition, this year WHO validated 13 countries for the elimination of diseases. We provided guidance on innovations, including lenacapavir for HIV prevention and GLP-1 therapies for obesity. And we responded to 48 emergencies in 79 countries and territories, including Gaza, Sudan, and Ukraine. 2025 brought other serious challenges. Aid cuts threaten to reverse decades of progress, with early estimates suggesting childhood mortality could rise for the first time this century. And cuts to WHO's budget left us with no choice but to reduce the size of our workforce. But in the crisis lies an opportunity for countries to transition away from aid dependency towards self-reliance, and the opportunity for WHO to become more independent and future-proof. The world still needs WHO, and WHO remains committed to our founding vision, the highest attainable standard of health, not as a privilege for some, but a right for all.
I found our world to be so beautiful. We come together as nations of the world because we choose not to be overwhelmed. We choose hope. We choose a better future.
Right now, across the world,
Lives are being saved.
quietly.
Often unnoticed.
A disease stopped before it starts.
Answers found.
Fears dispelled.
Health restored.
New treatments, emerging gene therapies, more personalized care. The science is there and evolving. What's possible today was unimaginable just a few years ago.
Every diagnosis that gives a family an answer. Every test that catches a disease before it's too late. in every home, in every clinic, in every country. That is science at work.
Science shows what is possible, from vaccine-preventable diseases to mental health. It backs every decision that shapes people's health and well-being. When we use science, when we act on it together, people live, people thrive.
Science only protects us when we use it, and right now, it's difficult to tell the difference between science-based advice and misinformation. The stakes for our health have never been higher. Science protects us.
Science gives us a future.
Science heals us.
Science guides us.
"2025 was the year of major achievements and challenges for global health and for WHO. The most significant achievement was the adoption of the WHO Pandemic Agreement, a powerful example of what multilateralism can deliver when countries choose cooperation over division. In addition, this year WHO validated 13 countries for the elimination of diseases. We provided guidance on innovations, including lenacapavir for HIV prevention and GLP-1 therapies for obesity. And we responded to 48 emergencies in 79 countries and territories, including Gaza, Sudan, and Ukraine. 2025 brought other serious challenges. Aid cuts threaten to reverse decades of progress, with early estimates suggesting childhood mortality could rise for the first time this century. And cuts to WHO's budget left us with no choice but to reduce the size of our workforce. But in the crisis lies an opportunity for countries to transition away from aid dependency towards self-reliance, and the opportunity for WHO to become more independent and future-proof. The world still needs WHO, and WHO remains committed to our founding vision, the highest attainable standard of health, not as a privilege for some, but a right for all.
Your Excellencies, honorable delegates, ladies and gentlemen, may I kindly ask you to join your seats? Thank you.
Ouais, c'est ce que je me suis dit. Et je parle quand? Ok, tu vas me donner.
Excelencias, Director General, honorables ministros, distinguidos delegados, es un placer darles la bienvenida al segmento de alto nivel de la 79ª Asamblea Mundial de la Salud. Nos honra esta mañana contar con la presencia de invitados distinguidos por invitación del Director General. Sin más preámbulos, tengo el honor de invitar a la excelentísima señora Elisabeth Baumschneider, consejera federal de la Confederación Suiza, a pronunciar unas palabras de bienvenida. Muchas gracias.
Monsieur le Président de l'Assemblée, Monsieur le Président, Monsieur le Directeur Général, Mesdames et Messieurs les ministres, Excellences, Mesdames et Messieurs les délégués, c'est un honneur et une joie renouvelée de vous accueillir ici à Genève, au siège de l'Organisation mondiale de la santé pour cette 79e Assemblée. Bienvenue, bienvenue dans une ville qui incarne la vocation universelle du multilatéralisme, un lieu de dialogue, un lieu de transmission de valeurs, de confiance et d'engagement commun en faveur de la santé pour toutes et tous. Je souhaite débuter mon propos en rendant hommage au personnel de l'OMS. Son expertise, son engagement quotidien permettent à l'organisation de rester à la hauteur de son exigeant mandat. Nous le constatons actuellement alors que l'OMS joue pleinement son rôle dans la coordination internationale face à l'hantavirus ou encore au virus Ebola, indépendamment des enjeux qui sont sensiblement différents. L'année écoulée a été marquée par un net durcissement du contexte international. Le budget de l'OMS a été réduit de l'ordre de 21%, soit près d'1 milliard de dollars. Des centaines d'emplois ont été supprimés, des programmes ont été réduits. L'OMS a su se réformer en profondeur, dans l'urgence, tout en continuant d'assurer sa mission essentiel. La Suisse vous en est profondément reconnaissante. C'est dans ce contexte difficile et intense que s'inscrit la redéfinition de la santé mondiale. L'OMS doit en rester le centre et le moteur. En tant que pilier normatif, technique et de coordination, en tant qu'unique organisation de santé mondiale à vocation universelle. C'est à l'OMS qu'il appartient de conduire cette transformation, et ce, en étroite collaboration avec les autres institutions de santé globale. Cette conviction, basée sur des valeurs d'équité, d'accessibilité et d'interdisciplinarité, prend tout son sens ici à Genève, capitale internationale de la santé publique, véritable écosystème où convergent organisations internationales, recherche, innovation, société civile et secteur privé. Mesdames et messieurs, la Suisse assume sa responsabilité d'État hôte pour préserver, pour renforcer cet écosystème à travers 3 axes. Premièrement, un soutien financier concret. Face aux contraintes budgétaires actuelles, la Suisse a débloqué une enveloppe de 269 millions de francs pour renforcer la Genève internationale d'ici à 2029, dont l'OMS bénéficie à plusieurs égards. Le deuxième axe est un engagement en faveur d'un financement durable à travers l'augmentation progressive des contributions obligatoires. L'OMS a besoin d'un financement stable, d'un financement prévisible pour justement planifier, anticiper, agir, réagir. Avec seulement 25% de contributions obligatoires, cette stabilité, vous en conviendrez, reste insuffisante. La Suisse plaide depuis de nombreuses années, de manière réitérée, pour un rééquilibrage. Enfin, le troisième axe est un soutien aux réformes au sein de l'OMS et du système onusien. Les fragilités actuelles doivent être saisies comme une opportunité de renforcer l'efficacité collective. L'OMS occupe une place unique. Elle est la seule organisation de santé présente sur les 3 axes de réforme de l'ONU. Elle est irremplaçable. Nous devons tous, en tant qu'États membres, faire preuve de courage en repensant non seulement l'OMS, mais aussi ses interdépendances avec l'ensemble du système des Nations Unies. Dans le cadre des réformes ONU 80, il est donc crucial, je dirais même vital, de renforcer le rôle de la santé comme pilier central de la sécurité mondiale. L'OMS doit être capable de continuer à agir et l'écosystème qui gravite avec et autour d'elle à Genève doit s'adapter. Mesdames et messieurs, dans un monde marqué par la multiplication, la densification des conflits et des crises humanitaires, ce sont avant tout les populations qui souffrent. Les conflits et les contextes fragiles sont aussi des terreaux fertiles pour les crises sanitaires. Ils soulignent la nécessité d'une OMS forte, d'une OMS capable d'agir, et ce tant au niveau de l'élaboration des politiques de santé que de leur mise en œuvre concrète sur le terrain. La crédibilité du multilatéralisme se mesure à ses résultats concrets. 3 domaines illustrent cette volonté d'obtenir des avancées tangibles, significatives. Premièrement, la santé comme vecteur de paix, à travers l'initiative globale Santé et Paix, portée notamment par la Suisse et le Sultanat d'Oman et formalisée par une résolution adoptée en 2024. Nous développons actuellement un cours pour les professionnels de santé afin de les sensibiliser au contexte de tensions ou de conflits. Comprendre et faire respecter le droit international humanitaire, en particulier la protection de la mission médicale, est aujourd'hui plus fondamental que jamais. La santé ne peut pas, ne doit en aucun cas devenir une cible. Elle est un bien public mondial et doit être protégée en tout temps. Deuxièmement, nous allons continuer à travailler sur l'annexe à l'accord sur les pandémies portant sur un mécanisme pour l'accès et le partage des avantages liés à l'échange d'informations sur les agents pathogènes. L'adoption de l'accord sur les pandémies en mai de l'année passée a démontré que les États membres ont toujours la volonté d'œuvrer ensemble pour le bien commun. Mais cet accord ne pourra entrer en vigueur que lorsqu'une solution aura été trouvée, négociée sur l'annexe. Les discussions sont complexes et la Suisse reste engagée pour trouver des solutions réalistes, fonctionnelles et fondées sur un mandat clair, tant pour les futurs États parties que pour l'OMS. Il sera également essentiel de poursuivre le développement international du système BioHub de l'OMS afin de garantir un partage des agents pathogènes sûr, efficace, équitable, contribuant au renforcement de la sécurité sanitaire à l'échelon mondial. Troisième domaine d'action, la résistance aux antimicrobiens. Cette Assemblée est invitée à adopter la mise à jour du plan d'action mondial sur la résistance aux antimicrobiens qui renforce l'approche multisectorielle et intègre les nouveaux engagements internationaux. Nous sommes toutes et tous concernés. Permettez-moi de prendre l'exemple de mon pays, la Suisse, qui n'est pas épargnée par ce danger. Les infections résistantes y causent environ 300 décès par année et l'OCDE estime que leur coût direct et indirect pourrait atteindre jusqu'à 748 millions de francs par année d'ici 2050 pour la Suisse. C'est pourquoi nous attachons une importance particulière au renforcement de la surveillance et de la lutte mondiale contre la résistance aux antimicrobiens et à la mise en place d'incitations durables pour relancer la recherche et l'innovation antibiotique. Le plan d'action mondial actualisé constitue une base solide, crédible à cet égard. Mesdames, Messieurs, tout ce travail, nous le menons pour les générations actuelles, mais aussi pour celles de demain. Et pour elles, la réponse ne viendra pas uniquement des soins, elle viendra aussi de la prévention. Deux défis illustrent cette conviction. La santé mentale d'abord. 1,1 milliard de personnes vivent avec un trouble de santé mentale et le suicide reste malheureusement la troisième cause de mortalité chez les jeunes. Ces chiffres ne sont pas seulement alarmants, ils révèlent un échec collectif de la prévention. La Suisse s'engage, y compris à travers sa coopération internationale, en faveur de services intégrés et de proximité favorisant la détection précoce et l'intervention rapide. Le lien entre santé et climat représente lui aussi un défi urgent pour nos populations. Le changement climatique n'est pas un risque futur lointain, c'est un risque systémique actuel qui se manifeste aujourd'hui déjà par des impacts concrets et dévastateurs sur la santé. À l'échelle mondiale, l'OMS projette 250 000 décès supplémentaires par an d'ici les années 2030 sous l'effet du changement climatique, notamment via le paludisme, les inondations ou encore la malnutrition. Les pays à faible revenu et les petits États insulaires en développement sont ceux qui subissent les conséquences sanitaires les plus graves. Agir sur les déterminants environnementaux de la santé, c'est de la prévention à grande échelle. C'est une posture humaniste dans laquelle nous devons nous engager. La Suisse s'y engage, notamment à travers l'Alliance Attaque de l'OMS et sa présence active dans les processus environnementaux internationaux. Dans ces deux domaines, une même logique s'impose. Investir en amont coûte moins cher et surtout sauve plus de vies et protège mieux les générations futures. Ces générations sont représentées ici même, comme je le constate, de nombreuses délégations incluent des délégués de la jeunesse. Il est essentiel non seulement de leur donner la parole, mais également de les écouter, d'instaurer un véritable dialogue, car nous ne pouvons pas construire l'avenir sans celles et ceux qui le vivront, cet avenir. À l'initiative de la déléguée suisse de la jeunesse, un stand a été mis en place qui met en valeur l'engagement durable des représentants de la jeunesse au sein de leur délégation, ainsi que le réseau global qu'ils ont développé entre eux. Un réseau dont nous pouvons tous bénéficier des expériences et des impulsions. Les jeunes sont aussi celles et ceux qui hériteront des outils que nous construisons aujourd'hui, notamment l'intelligence artificielle et la digitalisation de la santé. Ces technologies offrent un immense potentiel, pour autant qu'elle repose sur un fondement essentiel, la qualité des données. Pour émettre des recommandations solides en matière de santé, nous ne pouvons pas nous contenter de données fragmentées ou encore insuffisamment fiables. Une intelligence artificielle ne saurait être plus pertinente, plus probante que les données qui l'alimentent. Dans le domaine de la santé publique, des données très pertinentes existent, mais elles restent parfois difficilement accessibles. On ne saurait négliger le fait que même les statistiques officielles ne sont pas à l'abri de dynamiques préoccupantes. Sorties de leur contexte ou mal interprétées, elles peuvent fragiliser la confiance du public, voire même l'éroder et affecter la qualité du débat. C'est pourquoi, mesdames et messieurs, nous avons une responsabilité partagée. Nous devons garantir que des données fiables restent accessibles, restent compréhensibles, restent utilisables. C'est précisément le sujet de notre événement parallèle ce midi. Cette thématique est une priorité pour la Suisse et c'est en ce sens que nous entendons contribuer aux discussions en cours au sein de l'OMS. La Suisse accueillera également le sommet mondial sur l'intelligence artificielle en 2027. Des données fiables sont également essentielles pour maintenir la confiance dans les connaissances scientifiques, mais également la confiance dans la réputation des institutions qui les portent. Cela requiert une culture de collaboration, une compréhension commune et le travail en commun avec de nombreuses institutions scientifiques. C'est pour cette raison que la Suisse place les centres collaborateurs de l'OMS au cœur de cette vaste et importante réflexion. Ce sont eux qui produisent et ancrent et valident les connaissances scientifiques sur lesquelles repose l'action de l'OMS. Nous avons récemment organisé un premier dialogue avec ces centres collaborateurs au niveau national, un dialogue que nous souhaitons poursuivre. Fort de cette expérience, nous invitons l'OMS à organiser une nouvelle réunion mondiale des centres collaborateurs à Genève en 2027. La Suisse se tient prête à soutenir pleinement ces démarches. Mesdames et messieurs, le thème de cette Assemblée, redéfinir la santé mondiale, est à la fois un défi et une promesse. Un défi face aux crises actuelles, une promesse grâce à notre capacité à agir ensemble en faveur de la santé mondiale. La Suisse croit en l'OMS et en la force du multilatéralisme. Pour conclure, j'ai le plaisir de vous inviter à la réception de la Suisse qui se tiendra dès 18h à l'OMS pour découvrir des spécialités culinaires de mon pays, mais surtout pour échanger. Ce sera l'occasion de continuer nos échanges dans une atmosphère conviviale, j'espère, et je me réjouis déjà d'avoir l'honneur de vous saluer nombreux à cette réception. Je vous souhaite des travaux fructueux, des satisfactions à la hauteur de vos attentes et de vos engagements si précieux. Merci beaucoup de votre attention.
Muchas gracias, señora consejera federal. Antes de seguir con las intervenciones de nuestros invitados de alto nivel, disfrutaremos de una actuación cultural a cargo del grupo de danza tradicional de Ghana. Adelante. De buena jera, pues. Muchas gracias al grupo de danza tradicional de Ghana por esta vibrante actuación. A continuación, tengo el privilegio de invitar a nuestro invitado especial de honor, al excelentísimo señor John Dramani Mahama, presidente de la República de Ghana, a dirigirse a la Asamblea.
Thank you very much. That was a pleasant surprise for whoever organized that cultural dancing. That is a group from Ghana. Your Excellency Elizabeth Baum-Schneider, Federal Councillor of the Swiss Federation, Dr. Victor Atala Lajam, President of the 79th World Health Assembly, Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, Honorable Ministers of Health, Heads of Delegation, distinguished delegates, ladies and gentlemen. We meet at the 79th World Health Assembly amid uncertainty, shifting global geopolitics, and deliberate assaults on the world's multilateral system have created doubts about the trajectory of global health cooperation and reform. 6 years after the last global pandemic, COVID-19, the world health architecture is changing rapidly. Overall, humanitarian assistance is reported to have declined by 40%, and some of the largest Western economies have significantly cut their overseas development assistance. The World Health Organization's budget has been gutted by the withdrawal of U.S. assistance, forcing the organization to scale down programs and undertake steep staff retrenchments. In Ghana, health financing from bilateral and multilateral partners has significantly decreased since 2025. Ghana lost $78 million in health funding following the closure of U.S. aid programs. This money went mainly into malaria programs, maternal and child health, nutrition, HIV/AIDS programs, including testing and delivery of antiretroviral drugs. In South Africa, the abrupt withdrawal of PEPFAR funding has shut clinics, terminated gender-based violence programs, and left 1.4 million people living with HIV uncertain about their treatment continuity. And we're told that by 2030, 9 million preventable deaths could occur due to these shifts. It is estimated that the direct consequences of this aid suspension could push about 5.7 million Africans into poverty by the end of 2026. It is this gloomy outlook for the future of global health that prompted the convening of the African Health Sovereignty Conference, famously known as the Accra Reset, in August last year. It is against this backdrop that we meet at the 79th World Health Assembly. These troubling statistics are known, and we're not here to lament or wring our hands over them. We're here, among others, to decide whether the architecture we supervise is still fit for purpose. We're here to discuss how we can continue to save lives even in the face of adversity. And I stand here before you today in the second year of my new tenure as president, mindful that the mandate given to me by my people is not merely to administer, but to transform their lives. I come from a continent that has too often been the subject of global health policy rather than its author. Today, I speak to you as one of the advocates of the Accra Reset Initiative, a movement born from the conviction that the old paradigms of dependency must give way to a new era of health sovereignty. These cuts in humanitarian assistance and ODA, as painful as they are, serve as the final clear signal that the old system of donor dependency is past its sell-by date. We're witnessing the end of an era, and we must have the courage to build the next one. We're contending with an international architecture that was under strain long before these cuts even occurred. We have more global health organizations than ever, and yet country-level fragmentation has worsened. We do not come to Geneva to mourn the past. We come to build a future where a country's health is not a byproduct of charity, but a result of sovereign capability. This desire to take our health destinies into our hands imposes important responsibility on us as African leaders. We must see health spending as an investment rather than just a social obligation, because a healthy population is indispensable to economic progress. As an advocate for African health sovereignty, I'm obliged to demonstrate this practically at home. And so in Ghana, we have moved beyond rhetoric to implement calculated, aggressive policies that place the citizen at the center of the clinical encounter. With one of the more successful national health insurance schemes in Africa, Ghana has an insurance coverage estimated at 66% as at the end of 2025. This still leaves about 34% of our population without coverage. Besides, the NHIS has been focused principally on curative care with very little attention to preventive care. To mop up the remaining population not covered by the NHIS, we have recently successfully begun implementing our free primary health care program. By removing financial barriers to the most basic and essential services at the rural level, we've ensured that our citizens in the remotest regions of our country also enjoy access to quality health care on par with their urban counterparts, with an eye on preventive care. And we're grateful that the WHO, led by Dr. Tedros Ghebreyesus, was among the first to congratulate us on achieving this significant milestone. Thank you, Tedros. We have revitalized our national health insurance scheme, the NHIS. By removing the cap on the health insurance fund, we immediately freed up an additional 3 billion Ghana cedis, equivalent to $300 million for healthcare investment. We've also streamlined national health insurance scheme operations by eliminating bottlenecks, utilizing digital tools, including AI, to detect fraudulent claims, and most importantly, prioritizing prompt refunds to service providers. Because a health insurance scheme is only as strong as the trust between the state and the hospitals that provide the care. By ensuring our providers are paid on time, we ensure that our citizens are treated with dignity. We've also confronted the rising tide of non-communicable diseases by launching the Ghana Medical Trust Fund, also known as Mahama Cares. This fund is a lifeline for those suffering from non-communicable diseases, cardiovascular conditions, cancers, liver disease, and renal failures that were previously a death sentence for the poor. Mahama Cares is ensuring that specialized high-cost care is not a privilege for just a few, but is a right for all. Ghana, I'm also happy to report, is on track to exit Gavi funding for vaccines by the year 2030, and we hope to transition into a donor in the not-too-distant future. These domestic achievements are the foundation of my leadership of the Accra Reset Initiative. Ladies and gentlemen, this Assembly is set to consider a proposal for joint process to reform the global health architecture. Ghana, having co-chaired the working group for the Lusaka agenda, welcomes this. But as a committed apostle of reform of the World Health Architecture, I'm concerned about whispers I have heard that the current draft resolution seeks to protect existing organizational mandates and prohibit the recommendation of mergers or consolidations. In Mali, the Dogon people warned that do not let the sight of those eating roasted maize force you to cook your maize seeds. If we launch a process of reform that is prohibited from recommending actual reform, we are merely performing a ritual. We cannot prioritize institutional comfort over human survival. The WHO's legitimacy is not served by protecting silos. It is served by a fearless analysis of what works. When I hosted Director General Tedros, President Obasanjo, and many others in Accra in 2025, we firmed up a vision for health sovereignty. To us, sovereignty is the practical capacity to finance core functions predictably, regulate quality at the regional level, and produce critical inputs locally. A continent that manufactures less than 1% of its vaccines while carrying 25% of global disease burden is not sovereign, it is vulnerable. It is at best a ward of the international system. And by sovereignty, we do not mean isolationism. We're advocating the practical capacity of a nation to finance its own core functions, regulate its own quality, produce its own medicines, and govern its own data. Ministers of health in the Global South often spend more time writing donor reports than designing and fixing primary health care. This is a system that has confused the multiplication of institutions with the multiplication of impact. So to move beyond rhetoric, the Accra Reset, supported by a Presidential Council of Leaders from the Global South, is implementing 3 operational pillars. The first is the High-Level Panel on Reform. This is an independent body of global experts scrutinizing the global health architecture. The second is the Reform Interlock and Observatory. It's a coherent mechanism to ensure that the strategies of the WHO, Gavi, and the Global Fund don't clash on the desk of a district health officer in rural Africa. They must be in sync. And there is HING, we call it HING, that is Health, Investment, National Gateway, and Enablers. This will serve as the operational engine that converts political will into bankable, executable investments in local manufacturing and bioinnovation. In Ghana, we're leading by example. Our 2026 budget committed 34 billion Ghana cedis, equivalent to $3.4 billion to health and expanded coverage to 20 million people. We're not lecturing from theory. We're building the evidence of what a sovereign health system should look like. And as I prepare to join Thank you. And as I prepare to join many of you at our side event later today to discuss health sovereignty in depth, I leave this assembly with 3 requests, 3 asks. First, let us not let reform be a ceiling. If we are to fix the system, we must be brave enough to look at institutional mandates and measures without fears. Second, let us invest in execution. The world does not need more communiques. It needs deal rooms, local factories, and resilient supply chains. And third, let us measure success by the clinic, not the conference. The only metric that matters is whether a child in the Global South has a reasonable chance of survival as a child in the Global North. Colleagues, the old global health order built in the aftermath of a different century is tottering. But a new order is rising. And this will be an order that is defined by agency, not aid, by partnership, not paternalism. And it is being built for the mother in the Global South, who, even as we speak this morning, will be delivering her child under the light of a lamp tonight. In Africa, we have a saying that one who plants the tree does not always sit in its shade. The reforms we are discussing today are for the generations we may never meet. And yet let our seriousness today be the shade they will rest in tomorrow. And so on this note, I thank Dr. Tedros and the WHO for your leadership, and I thank you to be a special guest at this assembly. I thank you for your partnership.
Muchas gracias, Excelencia. Tengo el honor de invitar al excelentísimo señor Emmanuel Macron, presidente de la República Francesa, a pronunciar su intervención. Vamos a mover al siguiente. Tengo el honor de invitar al excelentísimo señor Ahmad al-Shara, presidente de la República Árabe Siria, a pronunciar su intervención.
بسم الله الرحمن الرحيم. معالي المدير العام لمنظمة الصحة العالمية الدكتور تيدروس، أصحاب الفخامة والمعالي، السيدات والسادة، أخاطبكم اليوم من دمشق في لحظة يواجه فيها العالم تحديات تتطلب إرادة دولية مشتركة تضع صحة الإنسان في صدارة الأولويات وتؤسس لمستقبل أكثر أمنا وعدلا. وتأتي مشاركتنا في أعمال الدورة 79 جمعية الصحة العالمية لتؤكد أن سوريا وهي تمضي بخطى واثقة في مسار التعافي تؤدي اليوم دورا محوريا وفاعلا في صياغة أمن صحي إقليمي وعالمي مستدام. إن رؤيتنا تنطلق من مبدأ صحة الإنسان أولا بوصفه غاية وطنية مستدامة، وانطلاقا من هذه الرؤية نعمل على إعادة بناء منظومتنا الصحية لتكون شبكة أمان متينة تكفل العدالة والشمولية لكل مواطن ومواطنة، وتمتد خدماتها إلى كامل الجغرافيا السورية. وتضع جمعيتكم الموقرة الارتباط الوثيق بين تغير المناخ والصحة في صدارة أولوياتها، فإن مسيرة الإعمار في سوريا تؤسس لواقع بيئي وصحي مستدام يصون أمن أجيالنا القادمة. ولأن الاستقرار الإنساني هو جوهر الاستدامة، فقد التزمنا وطنيا بطي صفحة المخيمات بحلول عام 27 و2000، إذ نرى في هذا الهدف تجسيدا عمليا لخطة العمل العالمية للمناخ والصحة. فالطريق الأساس لحماية الإنسان من التداعيات المناخية يكمن في تأمين عودته من البيئات الهشة إلى رحاب الاستقرار والحياة الآمنة والكرامة الإنسانية. السيدات والسادة، إن التحديات الكبرى التي واجهناها والتي نتجاوزها اليوم بثبات منحت بلادنا منعة تجعلها ركيزة أساسية في حماية الأمن الصحي العالمي، ونحن نمضي في مشروعنا الوطني مستندين إلى إرادة شعبنا وطاقاته وإلى كفاءات السوريين حول العالم الذين يمثلون رصيدا وطنيا وشريكا أصيلا في بناء وطنهم في تكامل مع الشراكات الدولية والتعاون العالمي المثمر. ومن هذا المنطلق تحضر سوريا اليوم لترسخ شراكات بناءة تقوم على تبادل الخبرات والموارد لخدمة صحة الإنسان، ونمد أيدينا لنضع تجربتنا قيمة مضافة في هذا الجهد الإنساني المشترك. أشكر لكم اهتمامكم، ولكم من دمشق ومن شعب سوريا كل التقدير والسلام.
Muchas gracias, Excelencia. Tengo el honor de invitar ahora a la excelentísima señora Mia Mottley, primera ministra de Barbados, a pronunciar su intervención.
What does it profit the world to win the argument and lose the people? The argument over who pays, the argument over who waits, the argument over whose suffering counts and whose can be deferred. Dr. Tedros, my brother and Director General of the World Health Organization, Your Excellency John Dramani Mahama, my dear brother, President of Ghana, Ministers of Health, distinguished delegates, friends. We meet when the world must decide what kind of civilization cannot be a slogan we polish in crisis. It must be a permanent covenant, predictable, financed, and yes, fair. The pandemic agreement was an important step. This assembly must finish the work that gives it meaning, fair access to pathogens, data, vaccines, diagnostics, and treatments. Equity cannot be an appendix to security. My friends, equity is security. For small island developing states, this is lived existence. In Barbados, we have said that health is not only what happens in a hospital ward. It happens in the household, in the school, in the supermarket, the workplace, in the atmosphere itself. We can measure the acceleration of the climate crisis with precision. However, we struggle to change the habits that effectively take our people from us through diabetes, hypertension, heart disease, cancers, and of course, mental distress. This is why the Bridgetown Declaration on NCDs and mental health was never merely a Caribbean document. It was a warning and a roadmap. Climate, debt, commercial determinants of health, mental health, and non-communicable diseases are all one story, carried in the bodies of our people. So again, I ask, what does it profit the world to win the argument and lose the people? Barbados is not waiting to be rescued. We cannot afford to. We have invested in people and science. Our Best dos Santos Public Health Laboratory has been recognized as a WHO National Influenza Center, and it proves that small states can meet global standards. We're building pharmaceutical manufacturing capacity out of necessity, building on what we had from the 19th century as an initial pharmaceutical fill and finish firm. Supply chain resilience begins when we stop accepting dependency as our destiny. My friends, small states are not asking for pity. We're asking for a system that recognizes reality. Vulnerability is not measured by income alone. Fiscal space must be judged alongside climate risk, debt burden, disease burden, and yes, the cost of survival. The Bridgetown Initiative taught the world that development finance must be redesigned for the century in which we live. The same is true for health financing. Emergency money must move with the speed of emergency. The WHO must not be asked to protect 8 billion people on planet Earth on the basis of uncertain contributions and political mood swings. My friends, declarations will not heal a child. Speeches will not train a nurse. Resolutions will not stock a pharmacy. And indeed, hospitals cannot be built with short-term capital. What will make a difference is implementation. Let this World Health Assembly choose cooperation over fragmentation, science over suspicion, facts over fiction, and solidarity over short-term self-interest. I started with the question, what does it profit the world to win the argument and lose the people? Here is the answer. It profits us nothing. No one nation will be safer. Not one economy will be stronger. And above all else, not one child will be healthier. Our task, therefore, is not to win the argument. Our task is to save the people. Let us act with that courage. Let us finance that courage. And let us build a multilateral system, imperfect as it may be, that remains our best hope for a healthier, safer, fairer world. It is not beyond our capacity. We know how to do it, and we shall do it with those who are ready. Let us to the task move. Thank you.
Muchas gracias.
Thank you, Excellency. I have the honor to invite the Secretary General of the United Nations, His Excellency Mr. Antonio Guterres, to give his remarks.
Excellencies, dear colleagues, I send warm greetings to the 79th World Health Assembly. This annual gathering is a vital opportunity for member states to align and accelerate efforts to address global health challenges that have rarely felt more daunting. Over the past year, cuts to bilateral and multilateral aid have disrupted health systems and widened inequalities. Clinics have closed, health workers have lost their jobs, prevention, surveillance and care have been weakened. Lives have been cut short. Meanwhile, the World Health Organization has reprioritized and recalibrated while continuing to deliver for member states, preserving core functions while providing technical leadership, operational support, and a trusted convening space, delivering urgent health support within multiplying humanitarian emergencies, and looking to health challenges on the horizon. From the need to expand universal health coverage to the effects of climate change on people's health, to your discussions on pandemic preparedness, including the pathogen access and benefit sharing annex. WHO stands at the center of our global health architecture. It must be strong and independent, with ample and sustainable financing. This Assembly's work is critical for global health security and the promise of health for all today and tomorrow. I thank all Member States for your leadership, commitment and partnership for a healthier, safer and fairer world. And I wish you a very successful World Health Assembly.
Muchas gracias.
Many thanks, Mr. Secretary General. I should like to express my sincere thanks to all of our guest speakers for honoring us with their presence and for their video statements. It's my great pleasure now to invite the Director General of the World Health Organization, Dr. Tedros, to give his remarks.
This room is very majestic. We came back, I think, after how many years? 6 or 7. Your Excellency John Mahama, President of Ghana, Your Excellency Elizabeth Boume Schneider, Federal Councillor of the Swiss Confederation, President of the 79th World Health Assembly, Dr. Victor Atala Lajem, the UNOG Director General Tatiana Valoyova, Excellencies, Honorable Ministers, and Heads of Delegation, dear colleagues and friends. Good morning and welcome. And my thanks to Your Excellency, Councillor Boume Schneider, for your warm welcome and for Switzerland's continued hospitality in hosting WHO and the World Health Assembly. My thanks also to Your Excellency, President Mahama, for honoring us with your presence and for your inspiring message today. Thank you for your leadership over the past year, especially in launching the Accra Reset at the Africa Health Sovereignty Summit in August, where I was honored to join you. And also would like to thank the President of Syria, the Prime Minister of Barbados, and our Secretary General for their messages today. This time last week, I was in Spain, where we had just completed the successful disembarkation and repatriation of the passengers aboard the MV Honduras. I thank His Excellency Prime Minister Pedro Sanchez and Minister Monica Garcia Gomez, who is with us today, for their outstanding leadership and partnership in response to the hantavirus outbreak. Muchas gracias, Minister. And His Excellency, Prime Minister Sanchez, will join us in the afternoon and look forward to welcoming him. And as you know, yesterday I declared a public health emergency of the international concern over the Ebola outbreak in the Democratic Republic of the Congo that has already spread to Uganda. I will say more about both outbreaks, hantavirus and Ebola, in my address to member states this afternoon, which is the technical report which I will in the afternoon. These two are just the latest crises in our troubled world. From conflicts to economic crisis to climate change and aid cuts, we live in difficult and dangerous and divisive times. As you all know, WHO has itself been through a difficult period as a result of sudden and steep cuts to our funding. Many people, as a result, have questions about the impact of those cuts for the future of WHO, and they want to know what's going on. And today, I want to address those concerns by telling you what we have done, what we are doing, and what we will do to build a stable and resilient WHO and secure its future. In fact, the work did not begin last year. It began 9 years ago when we started the WHO transformation, the most ambitious reform agenda in the organization's history, because we knew such a scenario could happen. And there are dozens of ways in which WHO has transformed and continues to transform to meet the changing needs of member states. Today, I would like to highlight just three among a long list of changes we're trying to make, just three. The changes we made to our core normative and technical functions, the changes we made to our work in emergencies, and the changes we made to our financial model. I will also update you on our restructuring and our work on reform of the global health architecture. First, our core mandate: science, data, norms, and standards, as some say, WHO's bread and butter. Prior to 2019, the way WHO developed normative products was fragmented, with limited quality control or overview. So for the first time in the organization's history, we established a new science division, led by the chief scientist as a new executive position, to consolidate and strengthen WHO's normative and technical work. By the way, this work is going to help the organization, because we are saying, and many of you are saying, WHO should focus on its core mandate, and this is the core mandate. We have strengthened our evidence generation processes and aligned pre-qualifications of medical products with the introduction of living guidelines. For example, in the past, WHO would pre-qualify medicines and only then develop guidelines on their use. The process was disjointed and could take years. Last year, WHO pre-qualified the groundbreaking drug lenacapavir for HIV prevention at the same time as we developed the guidelines in just 8 months. But we also want to make sure that WHO doesn't just produce technical products that sit on a shelf, but that are put to use. So since 2024, we opened the WHO Academy in Lyon, France, which now offers over 400 courses in 23 languages, reaching over 120,000 learners so far. We're also leveraging the network of over 800 WHO collaborating centers, as the Federal Councillor had said earlier. We established the World Health Data Hub to consolidate our fragmented data and analytics capacities. We're investing in a modern data backbone, including an AI-powered single-point discovery for data, statistics, and knowledge products. We continue to modernize interoperability standards, including ICD-11, which is accessed 4 million times daily in 15 languages. And to support countries to harness the power of digital technologies and artificial intelligence for health, we established a dedicated department at headquarters with focal points across all 6 regions. The second major area of change came with the COVID-19 pandemic, which exposed many gaps in global health security and taught us all many lessons. And based on the gaps we identified, I will focus on 6 today, we're changing. And first, we saw the world needed enhanced capabilities to identify and respond to threats faster. So with support from Germany, we established the WHO Hub for Pandemic and Epidemic Intelligence in Berlin. Second, the pandemic exposed deep inequities in access to vaccines, diagnostics, and therapeutics. So we established the Access to COVID-19 Tools Accelerator, including COVAX, followed by Interim Medical Countermeasures Network. We also set up the mRNA Technology Transfer Hub in Cape Town, South Africa, which is now sharing technology with research centers in 15 countries. And the WHO Biomanufacturing Workforce Training Initiative in the Republic of Korea, which is supporting countries to build the workforce they need with the skills they need for local manufacturing. Third, to strengthen national capacity, together with the World Bank, we established the Pandemic Fund, which has so far disbursed $1.4 billion in grants to 128 countries. We also established the Universal Health and Preparedness Review, a peer review mechanism to build national capacity and enhance accountability. And fourth, to improve coordinated global sharing of pathogen materials, we established the WHO BioHub here in Switzerland, again, as Federal Councillor said, which has now shared 165 samples. And fifth, to enhance emergency workforce capacity, we established the Global Health Emergency Corps, which recently ran its second simulation exercise involving 600 health emergency experts and 25 partner organizations from 26 countries and territories. And six, we recognized that we needed to reform the governance of global health security to bring everything together into a cohesive whole. At this assembly 2 years ago, member states adopted a set of amendments to the international health regulations. And last year, you adopted the WHO Pandemic Agreement, a landmark instrument of international health law. The final remaining piece of the puzzle is the pathogen access and benefit sharing system, as has been said earlier by previous speakers, the PABS Annex. Of course, we had all hoped that negotiations would be completed in time for PABS to be adopted at this assembly. It hasn't happened yet, but I'm confident it will, and I thank member states for their commitment to continuing negotiations and seeking consensus, which I have no doubt you will find and address the last piece of the puzzle. The third major area of transformation and arguably the most significant is the historic change we're making the way WHO is financed. As they say, the economy is stupid. In terms of independence and avoiding shocks like now, it's the finance model stupid, which is central. When WHO was established in 1948, its only source of funding was from assessed contributions, the membership fees that countries pay. Voluntary contributions were introduced in the 1950s, but initially represented only about 20% of WHO's base budget. By 2017, that proportion had flipped. Assessed contributions accounted for only 20%, even sometimes low, of the base budget, and voluntary contributions accounted for more than 80%. What's more, the majority of voluntary contributions were and remain tightly earmarked for specific projects and programs selected by donors, making WHO vulnerable to shifting donor priorities and geopolitical winds. We recognized this over-reliance on inflexible voluntary contributions from a handful of donors as a major risk 8 years ago. It undermined the organization's independence, impeded its agility, and exposed it to shocks if a major donor were to withdraw or reduce its funding significantly. So, as you remember, together with member states, we designed a set of proposals to broaden our donor base or the revenue source and make our funding more predictable and sustainable. Several member states reduced earmarking and committed to higher levels of flexible and voluntary funding. And we thank these countries for their trust and support. We also established the WHO Foundation to tap sources of funding that we had not accessed before. Most significantly, we proposed a plan to increase assessed contributions from 20% base budget to 50%. In 2022, here at the World Health Assembly, member states approved it, a plan to increase assessed contributions to 50% of the base budget. Subsequently, they agreed to achieve that target in 5 installments. The first 2 have already happened, and the remaining 3 are due in 2027, 2029, and 2031. We cannot overstate just how transformational this change has been, and will continue to be, for safeguarding WHO's institutional independence and for protecting the organization against shocks like the shock that happened last year. If the first 2 installments had not happened, the impact of last year's funding cut would have been much worse, as you can imagine. Excellencies, honorable ministers, dear colleagues and friends, there are 3 key areas in which WHO has transformed: science, emergencies, and finance, among others. Now, I would like to update you briefly on the comprehensive process of prioritization and realignment that we have undergone in the past 16 months. Although the first 2 increases in assessed contribution cushioned the impact of the funding cuts we faced, they could not insulate us fully. In close consultation with member states, we reduced our program budget and undertook a rigorous analysis of every office and every program. Unfortunately, we were left with no choice but to say goodbye to a large number of dedicated, hardworking colleagues, and I would like to place on record my deep gratitude to all of them for their commitment and service. We have now completed the restructuring process. We have reached a position of stability and are moving forward with purpose and confidence. The crisis actually brought clarity and confirmed that what we have been doing the last 8 years actually is the right road to stability. We project that for the current biennium, 90% of the base budget is funded. However, we recognize that in the current environment, the remaining 10% will not be easy to mobilize. And because the majority of voluntary contributions remain earmarked, we continue to see pockets of poverty in many areas of our work. That makes it essential that member states fulfill their commitment to approving the remaining 3 increases in assessed contributions and to fully honoring the commitments you made in the investment round. At the same time, the work of reforming WHO to make it leaner and more effective, focused on its core mandate and efficient, will continue. There is always room for improvement. There are always lessons to learn. There are always things we can do better, should do better, and will do better. For us, I would like to assure you that change is a constant, and we will continue to change, not for the sake of change, but for the sake of countries and the people we serve. In some areas, this will require stepping back from work that others are better placed to perform. Because, after all, WHO is only one part of the global health architecture. Over time, that architecture has become increasingly crowded, complex, and fragmented. It's time for a renovation to build a new global health architecture fit for the future. At this assembly, member states will consider a proposal for a member state-led WHO-hosted joint process to reform the global health architecture. Our purpose is not to launch a new initiative, but to bring together the many existing initiatives that have proposed reforms of the global health architecture in part or in whole. That's why we have chosen as the theme for this year's World Health Assembly, Reshaping Global Health, a Shared Responsibility. And this is where the leadership of His Excellency President Mahama has been so decisive in launching the Accra Reset last year. In the past year, many countries have experienced severe disruptions due to sudden and steep cuts in the development assistance. Those disruptions and the damage they caused to the health of individuals, families, and communities were regrettable and avoidable. But they had an intended benefit. They prompted many leaders to say now is the moment to leave behind the era of donor dependency and open a new era of health sovereignty. This is the message of the Accra Reset, and the echoes of Accra are now resounding in Geneva and around the world. Thank you, Your Excellency, for your leadership on this. And you are very clear also in your message today. Every country should be able to depend on other countries for friendship, for solidarity, for support when needed. But no country wants to be dependent. Every country wants equity. Every country wants sovereignty. It's a cliche to say we are at a turning point, a fork in the road. In this case, it's true. This is the moment for change. This is the opportunity to take the road that leads to sovereignty, the road that leads to solidarity, the road that leads to equity. That's the road down which many countries are now walking. And that's the road that WHO is walking with you every step of the way. It's the road that leads to the destination that our founders set 78 years ago, the highest attainable standard of health, not as a luxury for some, but a right for all. I visited Malaysia recently, and I had a meeting with His Excellency, the Prime Minister. And one thing I picked up was Malaysia bole bole, Malaysia bole. It means Malaysia can. I think all countries can. And that's what President Mahama showed us in his examples, that it's possible to change, to have a paradigm shift. So bole bole, it's possible, we can. Thank you so much. Thank you.
Muchas gracias. Thank you very much, Dr. Tedros. Se me ha informado ahora que el director general desea reconocer la labor de varias personas excepcionales por su extraordinaria dedicación y su compromiso con el avance de la salud mental. Pero antes de proseguir con los premios, vamos a disfrutar de una actuación del ballet dominicano en Europa. Adelante, por favor.
Hay un país en el mundo colocado en el mismo trayecto del sol, oriundo de la noche, colocándose en un inverosímil archipiélago de azúcar y de alcohol, sencillamente liviano, como un ala de murciélago apoyado en la brisa, sencillamente claro, como el rastro del beso en las solteronas antiguas o el día en los tejados.
Muchas gracias al Ballet Dominicano Fed Like Home. Dr. Tedros, les ruego ahora que proceda a entregar los premios a los líderes de la salud mundial galardonados.
Thank you, Mr. President. It's my honor to now invite His Excellency President Mahama and the Director General Dr. Tedros for the award ceremony. Excellencies, Honorable Ministers, President of the World Health Assembly, distinguished delegates, on behalf of the Director General, it's my honor to present the Global Health Awards to 4 individuals who have made outstanding lifetime contributions to global health. First, Dr. Tore Godal of Norway. Dr. Godal's contribution Dr. Godal's contribution to global health is immense. He was instrumental in establishing numerous global health initiatives, including Gavi, CEPI, the Global Fund, Every Woman, Every Child Initiative, the Global Financing Facility, Rollback Malaria, the Medicines for Malaria Venture, and others. In DG's own country, Ethiopia, he conducted groundbreaking research on leprosy when he was director at the Armor Hansen Research Institute, which still awards an annual prize in his name to young Ethiopian researchers. He brought his knowledge and experience to WHO as director of the Special Program for Research and Training in Tropical Diseases, or TDR. In that role, he organized a clinical trial for a drug combination for leprosy that has now become the cornerstone of leprosy elimination efforts. He also organized a huge clinical trial of insecticide-impregnated mosquito nets Now I'd like to invite Dr. Heba Al-Suwaidi of Egypt. Dr. Heba Al-Suwaidi is a visionary leader whose commitment to health, dignity, and social justice has transformed the lives of thousands of people, especially the most vulnerable. From the early days of her humanitarian work, treating the wounded in Tahrir Square, she demonstrated courage, compassion, and an unwavering dedication of patient care. Through her leadership, she has advanced a comprehensive model to burn care that goes beyond treatment to emphasize prevention, rehabilitation, and reintegration. Her work supports survivors not only to recover physically, but to rebuild their lives with dignity, including through access to livelihoods and community inclusion. Dr. Al-Sawadi's approach shows that health is not only about saving lives, but about restoring hope and opportunity. Dr. Sawadi. Now it's my honor to invite the third recipient, Dr. Michael Ryan of Ireland, our own Mike. Dr. Ryan has devoted his career to protecting people in the most difficult and dangerous circumstances, bringing science, leadership, and humanity to the front lines of global health emergencies. Dr. Ryan possesses a rare combination of skills and experience from the clinical, the field, and the boardroom. As a former executive director of the WHO's Health Emergencies Program, he guided the world through some of the most complex crises of our time, including COVID-19, several Ebola outbreaks, and numerous humanitarian emergencies. Throughout the pandemic, he combined decisive leadership, technical insight, and authoritative communication. He was also instrumental in shaping many of the initiatives that WHO and member states have put in place in response to COVID-19, including the WHO Pandemic Agreement. He has been and continues to be a powerful advocate for equity, country leadership, and for the dignity of every person affected by crisis. Dr. Ryan, please. Our last awardee for the day is Dr. Marceline Dahl-Regis of the Bahamas. Dr. Dahl-Regis Dr. Dahl-Regis is a distinguished public health leader whose lifelong commitment to improving health has transformed lives across the Americas and beyond. Through her outstanding leadership in disease elimination, she has helped deliver some of the most significant public health achievements of our time. Her work, grounded in rigorous science and strong community engagement, has advanced equitable access to prevention and care. Dr. Dahl-Regis played a pivotal role in leading the Americas to become the first region in the world to be declared free of measles and rubella, a landmark achievement that continues to save lives. She has consistently championed a holistic approach to health and development, recognizing that strong communities are at the heart of sustainable progress. Her dedication, vision, and integrity have inspired generations of public health professionals. Dr. Dahl-Regis, please. Dr. Dahl-Regis. Come here. So, Your Excellency and DG, you may take your seats. I'll be inviting so may now invite the awardees for their remarks. Dr. Dahl-Regis first.
Mr. President, Director, your honored guests, distinguished delegates, thank you for this recognition, which I humbly accept on behalf of the many public health professionals, environmental health people, healthcare providers in the Bahamas, the Caribbean, the Americas, and countries around the world, and for my colleagues who serve tirelessly, often in difficult and dangerous circumstances at great personal sacrifice. Through my journey, I've been guided by exceptional mentors and multidisciplinary personnel whose resilience, compassion continue to inspire me. However, my greatest teachers have been the children, their courage and enduring hope that remind us why our work matters. Working with PAHO, WHO, many global committees, Gavi, international organizations, often tested my resolve, but also strengthened my sense of purpose. The achievements in public health and scientific advancement reflect your leadership, your collaboration, and commitment. You've saved billions of lives, improved quality of life, and protected future generations from devastating diseases. However, urgent challenges remain. Millions, especially those living in conflict zones, still lack access to basic health care. Delegates, we must act now. Our humanity is inseparable from our responsibility to preserve dignity and expand opportunity for all. Cooperation, Madam, cooperation must remain our guiding principle. The future can be brighter, but only if we act with purpose. Therefore, we must talk, not fight. We must expand access to healthcare for all. We must practice human rights, not merely speak about them. Solidarity remains essential, and we have good examples. So, distinguished delegates, in these ever-changing times, we must never grow weary in doing what is right. As we pass the torch to the next generation of public health professionals, let us do so with confidence that they will build a better future than we've known. We've done it before, we can do it again, and do it even better. Thank you.
Thank you, Dr. Ghebreyesus. May I now invite Dr. Tore Godal for his remarks, please.
Dear Dr. Tedros, ministers, colleagues, and friends, it is a great honor for me to receive this prestigious award. As you all know, and we have heard today, we are currently experiencing severe resource constraints for global health, and facts and evidence are under serious attacks. I've had the privilege to work with global health and WHO for over 55 years. As a scientist, I've been involved in building evidence for policy making. And with your permission, Director General, I will give you two earlier examples of building evidence in resource-constrained situations. Around 1990, we had several studies suggesting that impregnated bed nets protected children from malaria. But the policymakers at WHO refused to make a policy. I got sort of upset. And we therefore arranged in TDR for a randomized control study, putting close to 1 million children under bed nets. We documented in 1996 that it reduced overall child mortality by 20%. Impregnated nets then became immediately policy by WHO, but nothing happened because of lack of financing. In 2000, the Director General of WHO at that time, Gro Harlem Brundtland, convinced the G7 in Japan that the planned AIDS fund should also include malaria and tuberculosis. Then, with the support of the Global Fund, scaling up of bed nets happened, leading to halving of malaria deaths by 2012. A second example is in relation to Ebola. In August 2014, the cases of Ebola in Africa doubled every week. Some of us, including Jeremy Farrar, Marie-Paul Keeney, and Jon Arne Røttingen, thought we needed to develop a vaccine. We selected the one requiring only one dose. But we had only 8,000 doses and a few $1 million available, which shows a ring vaccination strategy to simplify the field work. After 9 months, the independent committee assessing the data asked us to break the code because the protection was statistically significant. Merck took on production, and we had a vaccine against the Zaire strain of Ebola. Now, with a different strain epidemic in Africa, it is important the work that is already being invested in by CEPI to actually develop then, with the aid of artificial intelligence, a pan-Ebola vaccine. I mentioned these two examples of innovative approaches to show how important it is that we, even at resource-constrained times, continue to build the facts and evidence for improving people's health. Thank you again, Dr. Tedros. Amasagnalo.
Thank you, Dr. Godal. May I now invite Dr. Heba Al-Suwaidi.
Hello. It is with deep humility and gratitude that I stand before you today to receive this distinguished recognition from the World Health Organization. My sincere appreciation goes to Mr. Tedros, the WHO Director General, and to the World Health Assembly. Thank you. Special gratitude to Ms. Hanan Balkhi, WHO Regional Director for the Eastern Mediterranean, for her nomination for this extraordinary honor and for your great support. Deep thanks to Dr. Khalid Abdel Ghaffar, Egypt's Minister of Health and Population, for his continuous support. This honor belongs to every member of Ahl Masr family who believed that burn victims deserve not only survival, but dignity, healing, inclusion, empowerment, and a future. Ahl Masr Foundation was established to change the reality of burn care in Egypt and the region. Today, through Ahl Masr non-profit burn hospital, the first and largest in the Middle East and Africa, we are proud to have transformed burn care in Egypt. In only 2 years since opening the hospital, we increased the survival rate of severe burn patients from 20% to 84%, while reducing permanent disability rates from 18% to 10%. We also performed Egypt's first cadaver skin transplantation procedure and helped save lives of more than 20,000 severe burn patients starting from just 3 months old. But our mission goes far beyond medical treatment. At Ahl Masr, we believe burns are not only a medical condition, but a social disease connected to poverty, violence, stigma, illiteracy, and inequality in healthcare access. This belief led us to establish the Ahl Masr Inclusion and Empowerment Center, supporting survivors through education, literacy programs, physical support, and psychological support, and economic empowerment. As part of our outreach program, and in collaboration with the Ministry of Health, we are developing Egypt's first telemedicine model for burn care across governorates with the vision of expanding it nationwide. Today, we are honored to partner with the World Health Organization and the Egyptian General Health Council in developing the world's first national burn management guidelines formulated at the country level. In collaboration with the World Health Organization and Ministry of Health and Population, we are also contributing to shaping the national strategy for burn treatment, prevention, rehabilitation, and care across Egypt for the next 10 years. In parallel, Ahl Masr is advancing towards designation as the first WHO collaborating center for burn care globally, with core mandates focused on training and capacity building, research, health, data systems, and burn prevention. We hope this will mark the beginning of a new global chapter where burn care receives the attention, collaboration, and investment it urgently deserves. Thank you to the World Health Organization for believing in this mission and for recognizing burn care as an essential part of global health equity. Thank you.
Thank you, Dr. Al-Suwaidi. And last but not least, Dr. Michael Ryan, please.
Excellencies, colleagues, my friends, those of you who know me will understand this. Now the real Mike Ryan can speak. I stand before you today. I'm humbled by this honor. But one thing this journey has taught me is that no achievement in global health or life is ever individual. Every success has belonged to the communities who welcomed us, to the workers who never gave up on the front line, to countries, partners and colleagues who've chosen action and solidarity over inaction and indifference. Thanks to my family, who sacrificed so much that I could do the work I do, to my community and friends who nurtured me, to the Irish state who educated a generation, me amongst them, and to the mentors like Tedros who gave me the opportunity to shine. I've had the privilege of serving in some of the most difficult circumstances imaginable. Outbreaks of Ebola, Marburg, cholera, dysentery, meningitis, polio, SARS-1, COVID-19, multiple disasters and humanitarian crises, where health systems were stretched beyond endurance. In those moments, statistics disappear. What remains are people, frightened families, exhausted nurses, brave community workers, and children whose futures depend on whether we act with speed, determination, courage, and compassion. The big numbers we always speak of disappear in the field. The N is not billions. The N is not millions. The N is not even thousands. The N is equal to one. One community, one family, one person, one child. The lessons I learned have been simple. First, health is not a privilege. It is a human right. Second, science matters. Facts matter. Truth matters. Public health cannot function in a world where disinformation spreads faster than disease. And third, and I think most importantly for me, the most powerful asset in any emergency is trust. Trust between governments and citizens, trust between scientists and governments, and between nations themselves. The world today faces enormous challenges: conflict, climate change, displacement, pandemics, failed immunization, profound inequity and mindless cruelty. Yet, I remain optimistic. I was once accused by a great friend of mine, Tom Grine, of being a pathological optimist. I'm glad to be in that club. Because I've seen extraordinary acts of courage, of kindness, of resilience in every corner of this world. Because I have seen incredible talent, commitment and capability in the so-called South. And because I have seen you all come together and agree on profoundly important global strategies and public health law, like the revised IHR and the pandemic agreements. It is time for WHO, and you, the collective ministers of the world, you are WHO. It's not the technicians, it's not the secretariat, it's you. And you need to evolve this organization that was designed 3/4 of a century ago to meet the challenges we face today. We must recognize again those who we truly serve, the people in every community, in every country, in every corner of the world. WHO needs to remain a unique convening, coordination and standard-setting platform, but I believe passionately that it also needs to be highly operational in public health emergency coordination, especially in fragile and conflict-affected settings. And I will never step back from that belief and that position, as I hope you never will either. To the next generation of public health leaders, I say this: stay curious, stay compassionate, and never lose your sense of outrage at injustice. Public health is at its core a commitment to human dignity, human equity and social justice. I accept this award on behalf of every health worker, logistician, laboratory scientist, cleaner, driver, translator, secretary and community volunteer who has dedicated their lives to protecting others. I only wish that my dear friends Aidan O'Leary and Pete Salama were here today. Thank you, Tedros, for your trust, for your shared belief that health for all and health equity is not an aspiration, it is an obligation. Thank you.
Thank you, Dr. Ryan. That concludes the award ceremony. I'd like to hand back to the President of the World Health Assembly. Thank you.
Muchas gracias, Dr. Tedros. Y enhorabuena a los galardonados por este reconocimiento tan merecido. Con esto queda concluida la bienvenida de alto nivel. La mesa de la Asamblea se reunirá a las 12 horas en la sala 12. Se levanta la sesión plenaria que se reanudará en esta misma sala a las 14:30 horas. Muchas gracias.